Yes, and thank you for being here. I think I'm almost the same age as the chair, but thinking of advertising and Fred Davis, front page challenge, smoke de Maurier for real smoking pleasure, smoke de Maurier, a cigarette of good taste. That's still in my head after 50 years. Talk about marketing. So I'm glad what you just said I think is important, Mr. Engel. But I just have one simple question for all of you, and perhaps Dr. Wang can start off. We've been listening to a lot of witnesses for a couple of months now, and we have another week of this. And there are pros and cons, and everybody has a point of view, from education to health. And believe me, I can't even believe we're talking like this, especially as a child of the 60s and 70s. However, there are folks who want to see this delayed. There are people who like to have this delayed by a year, and there are others who believe that let's get on with it. In Colorado, we've seen what has taken place, and we've seen what is taking place in Washington State, and we now have the issue at the forefront in the state of Massachusetts. And so I'd like to get a point of view from all of you of getting on with it and learning as we go, or is Canada ready for this great experiment?
Well, we'll start with Dr. Wang then.
Yeah, that's a great question. And, you know, being in the state that kind of was at the forefront and is at the forefront of legalization, I think we have had a lot of interest in what we've done and what has worked and not worked. I think, you know, as far as the timeline of when the rollout happens, I think as you guys are doing, as witnessed by this meeting this evening, I think you just have to be cognizant of some of the unintended consequences and the public health impacts, and make sure you have thoroughly discussed them and looked at states like us and to determine what's worked, what's not worked, and you know, what's the experiment been like us for, you know, for the past several years. So I don't know if I have the great answer for you outside of when it's time to roll out. You just have to make sure you've had these public health discussions like we're having tonight to make sure, you know, you're doing everything you can to curb that impact.
Let's go over to Professor Hammond.
You know, like you, I've been a part of a lot of these discussions, and there's a risk in thinking that legalization is inventing cannabis. We already have these products on the market. You can go in any big city and order it by mail and have it at your door the next day, or walk into a store. And so, you know, the question is I've heard people say, well, if it happens right away, we might still have 50% of the black market for the first year or two. Well, I suppose 50% is better than 100%. I think it's also worth remembering that a lot of U.S. states that have gone through this process took a couple of years before they even had the retail framework established. And I think it's probably been a talking point of the government, because I've heard it a lot, but I've heard the phrase, this is a process, not an event. Whether it's a talking point or not, I think it's absolutely true. And I would point again to the fact that we are now in our 50-something year of regulating tobacco. And so I don't know if you ever reach a point where you say everything is going to be in place. I understand the rush and the pressure that this has put on provinces and territories and municipalities. But I've also been impressed with the conversation being framed around public health. And I don't see a huge advantage in delay.
Okay, Ryan Forrest.
Sure, thank you. From a public health perspective as well, you know, I think that the criminalization of marijuana has led to, on its own, a number of public health harms. And so I would say that delaying would kind of propagate those harms and would be a mistake. But I would just add that, you know, legalization is sort of a social experiment, and we won't know for many years what the long-term public health effects of legalization are. But we do have, you know, a very long track record, as Dr. Heyman said, of regulating tobacco and alcohol, and so I would just urge the committee, I think, to consider some of the lessons learned from both tobacco and alcohol in their study of the bill.
And Greg Gingle.
So two key points I would make. One is that, I think we look at protecting youth as one of the objectives of the legislation. And if you were to ask a teenager in high school today, what's easier for you to get, alcohol or cannabis? And it's much easier for them to get cannabis. And I think having a regulatory framework on alcohol does impact their ability to access it. And so, putting that program in place, as Professor Hammond said, we already have a $8 billion market today in the illicit market. I think the other key factor as well is that if we look at, there are key learnings, as Dr. Wang went through, that we've learned from Colorado and other states, right? Making that shift from serving sizes, for example, in 2019, when edible products and those products come to market, many of the issues they faced in year one, such as having serving sizes for edible products and having unintended consequences of overconsumption, we've already learned from that. So making sure that having those programs in place and having, serving size restrictions, child-resistant packaging, again, it is going to be an evolution. There will be key learnings along the way, but we do have an advantage to take advantage of what we've heard from, Colorado, Oregon, and other states.
Okay, thank you very